psychiatric disorders, which of course are very common in children. Now, the two most common ones, or the ones they most likely test, are going to be the stranger anxiety and the separation anxiety. Stranger anxiety is going to occur in smaller children, so we're looking at children who basically start off with 6 months of age and upwards. The peak incidence of stranger anxiety is about 8 months of age, and it can occur until about the child is 2 years of age. So what happens here is that you have a child that comes in contact with a stranger or a perceived stranger to that child. The normal reaction for that child is that the child will cry. I mean, it's impossible for a child at that age to remember grandparents, aunts, uncles, cousins, etc. that maybe they saw a few months ago. So as far as that child is concerned, that person is a stranger, that's going to cause the distress, and that's going to cause the child to cry. A very common question for stranger anxiety is that it will be placed in a clinical setting. For example, a 2-month-old infant was taken to the pediatrician for his routine DPT shots. When the shots were given, he did not cry. He was taken again at the age of 4 months, and again he did not cry. However, when he was taken at the age of 6 months, he cried excessively. Which of the following helps explain this behavior? So, the explanation for this question is very simple. If you notice, the scenarios have not changed. It's always the same situation, always giving the same shot, always in the same place, always by the same individual. So what you have is a child who at 2 months didn't cry, 4 months didn't cry, and 6 months he did cry. What you have here is the initiation of stranger anxiety. And that is what's causing the reaction, and that's what's causing this child to cry. It is not a phobia. It has nothing to do with memory. It has nothing to do with the smell of the doctor's office. It has nothing to do whether or not he saw a needle. The only answer here is choice C, stranger anxiety. Separation anxiety is another type of anxiety, yet it occurs in an older child. The age range for separation anxiety is anywhere between the ages of 1 and 3. So what normally happens is that you have a child who, when the parents or the caretakers leave the room, what does the child automatically assume? The only thing that the child can automatically assume is, oh my goodness, they've left. They're never going to come back, and that's causing distress to the child, and that makes the child cry. But as the child gets older and he internalizes the concept of mother or father or whomever is the caretaker, then that child understands that even though I don't see you, you still exist, and I know you will come back. And that is what separation anxiety specifically deals with. The feelings of abandonment, the feelings that the child perceives when the parents are not in the room, and that is what causes the child to cry. The classic question is again in a clinical setting, in a real-life situation. So if you look at the next question, a 1.5-year-old was in the waiting room of the pediatrician's office when his mother had to leave the room. He immediately began to cry. Which of the following would help explain this behavior? The fact that he is between the ages of 1 and 3, the fact that his mother left the room, he's perceiving it as a form of abandonment. What would be a normal response? The child is going to cry, and that is what causes the separation anxiety. If the answer were autism, letter C, then what you would need to find in the question is that the child does not cry when the mother leaves the room. And the difference being that in autism, those children do not exhibit any kind of separation anxiety. So therefore, they never bonded with the parent, so if the parent leaves, it doesn't matter to them. Now, phobias are also things that are commonly seen in children. Now, here we have an older child, somewhere between the ages of 3 and 6. And it's very normal for children to have all kinds of phobias. It's very common, about 5% of school-age children. What do you see? Children are afraid of the dark. They're afraid of monsters. They're afraid of going out. They're afraid of things underneath the bed. So what you typically find is because of their fear, then they complain of stomach aches. They complain of headaches. They might have a lot of somatic symptoms to exhibit their anxiety disorder. They might also pull their hair. They might also bite their nails because that's how they are calming themselves down because of these phobias. The treatment for all of these anxiety disorders is really reassurance from the family, making sure that the child feels safe. In rare situations, do you need family therapy? In rare situations, do you need behavioral therapy? And in extremely rare situations, do you even need medications? And always remember that the SSRIs are absolutely contraindicated in the use of children as far as your examination is concerned. Now, the complications of these anxiety disorders will be the most common things, such as avoiding things. So these are children that are going to isolate themselves. They're not going to want to go out because they're afraid. They're afraid of running into the boogeyman. They're afraid of running into a monster. They're afraid of running into things. So rather than face these fears, they'd rather stay at home where they feel safe and they feel protected. They also could affect your self-esteem. Based on how you feel, that's going to affect your anxieties as well.